Hi, I'm Dr. Kim Petrone and I'm the medical director here at St. Anne's. I wanted to take a couple minutes of your time to talk about the COVID vaccine that will be coming to you soon. As employees of St. Anne's, we are eligible to have this vaccine, and we do know that at the Webster campus, it will be arriving around the time of Christmas. We're still waiting for our date on Portland. Before we get to the specifics of the vaccine, I just want to take a moment to also recognize the incredible work that you have all done. It cannot be strongly said enough that this has been an unbelievably challenging time for all of us. As a team, you have done everything physically and emotionally possible to get us through this difficult time. And yet we still have lost people we love, elders that we cared for, and this indeed is heartbreaking. We are so sorry for all that you've had to endure and all that you have gone through, and we are beyond grateful for the incredible commitment you have given to St. Anne's and to its elders. You have indeed earned the title of a healthcare hero. After many months, however, you heroes hopefully can recognize that we have a light at the end of the tunnel and that we have a newfound reason to be hopeful for a better spring. And that hope lies in vaccination against COVID-19 illness. So here are some facts about the vaccine that will help you make the most informed choice regarding receiving it. First and foremost, it's important for you to know that you are amongst the first people in the United States to be offered this vaccine. Both healthcare workers and elders in long-term care facilities and assisted facilities are receiving this vaccine first because elders in those facilities are the most vulnerable. It's really important that you consider taking this to protect yourself, to protect the people you love, and also to protect our elders. I want to talk a little bit about the safety of the vaccine. The vaccine is exceedingly safe. It has been tested in over 30,000 people, and most of those received very few side effects. There is a small portion of people that cannot receive this vaccine, and those are people that have anaphylactic reactions to vaccines or to other injectable drugs. People with normal allergies, such as allergies to food, dogs, cats, oral medications like penicillin, can still receive this vaccine and are encouraged to receive this vaccine. People do sometimes get minor side effects. What do I mean by minor? Things like feeling tired, having maybe a low-grade fever, feeling a little achy, having your arm get sore after you've been vaccinated. These are actually all signs that your immune response is appropriate, that you're actually mounting antibodies to the vaccine, and this means that you'll be protected should you come into contact with the virus. I've heard some people talk about the vaccine somehow changing their DNA, actually making them someone different. This is not possible. The vaccine does not have any DNA in it. It actually has messenger RNA in it. Messenger RNA is the recipe that the virus uses to make a protein that causes you to be sick. The vaccine having the mRNA causes your body to develop antibodies so that when you come in contact with the virus, you are protected and don't get sick from it. There is no way that this vaccine can change your DNA. I've also heard that people are worried that the vaccine can cause COVID illness. We are 100% sure that this vaccine cannot cause COVID illness. It actually doesn't have any of the virus in it. It just has the mRNA recipe. So there's no possible way for you to contract COVID from the vaccine. It's important to know that the vaccine is free, so that even if you don't have health insurance, you should consider getting the vaccine. We will be vaccinating our elders and our staff on both campuses, and both doses will be free. As I alluded to, you do need to take 2 doses of this vaccine. They're given roughly 3 weeks apart, and after you complete those 2 vaccines, we believe that you have a 95% chance of not getting COVID. So it's a very effective vaccine after you receive both your doses. I just want to close by saying again, thank you, and to ask you to really consider taking this vaccine. A lot has been said in the media and the press about this vaccine, but it is my medical opinion and the opinion of our top scientists at the CDC that this vaccine is safe and effective and will provide us an end to this pandemic. This truly is a time that we can start to be hopeful again. We all deserve to visit with our family, our friends, and to hug each other. In closing, I really encourage you to take the COVID-19 vaccine. I believe it is the best way that we can protect ourselves and protect our residents from the virus.
For my mother.
For my little guy.
Hi, I've decided to get the vaccine because I miss my participants. Since the pandemic has started, the day programs have closed, and I'm getting it for them, as well as my mom, who's in her 70s. And for my family here at St. Anne's and my family at home, that's who I'm getting the vaccine for.
I'm getting the vaccine for my son and my family, my colleagues, and the elders we take care of every day.
Because I want this pandemic to end, and it's the only way it's going to.
I'm getting the COVID vaccine due to I lost one of my friends due to COVID, and I also work on the COVID unit. It's a dire need for everyone to get vaccinated.
So the reason why I would like to get the vaccine is to protect the residents that I am taking care of and feeding every day, and also to protect my family.
For the well-being of our residents.
I am getting the COVID vaccine to protect the elders of St. Anne's, all of my coworkers, and my family and friends.
I'm getting the COVID vaccine for several reasons and several people. I have small children and I worry about their health and their safety. My wife also works in healthcare, and between the two of us, we come in contact with a lot of people who might potentially be exposed to COVID. So we really want to keep our family safe and be able to see our family. I'm also getting the COVID shot for the residents here at St. Anne's. They're one of the most vulnerable population, and they need all the help that we can give them to stay safe and continue to be safe.
So that we can celebrate in 2021 together.